Ever pondered why a tiny pill can make a life-threatening infection disappear like magic? Welcome to the fascinating world of antibiotics, the wonder pills that have revolutionized modern medicine. Antibiotics, in simplest terms, are drugs that fight infections caused by bacteria. They were first discovered in the early 20th century, with the first antibiotic, penicillin, discovered by Alexander Fleming in 1928. Since then, they've changed the face of medicine, turning once fatal infections into treatable conditions. But how do these tiny pills work their magic? It's all in the science. Antibiotics function in two main ways. Some antibiotics, known as bactericidal antibiotics, kill bacteria by interfering with their cell walls or contents. Others, known as bacteriostatic antibiotics, halt bacterial growth, giving your body's natural defenses a chance to wipe out the infection. Yet it's not always a case of popping a pill and waving goodbye to bacteria. Different antibiotics target different types of bacteria. This is why doctors must carefully select the right antibiotic for each infection. Using the wrong one can lead to antibiotic resistance, a growing concern in the medical world. Antibiotic resistance occurs when bacteria change in response to the use of these medicines. This makes previously effective treatments less effective, or sometimes ineffective. Imagine a world where a minor cut could lead to a serious infection just because antibiotics no longer work. That's the grim reality we could face if antibiotic resistance continues to grow. So, what can be done to combat this? The answer lies in responsible use. This means only using antibiotics when prescribed by a health professional, ensuring the correct dose is taken, and completing the full course of treatment, even if you start to feel better. It's also crucial to remember that antibiotics are not a cure-all. They don't work against viral infections like the common cold or flu. Using them unnecessarily only contributes to the rise of antibiotic resistance. To summarize, antibiotics are powerful tools in the fight against bacterial infections. They work by killing bacteria or halting their growth, allowing our bodies to fight off the infection. However, their effectiveness is threatened by the rise of antibiotic resistance caused by the misuse and overuse of these drugs. The future of antibiotics hinges on responsible use and continued research into new treatments. Together, we can ensure these wonder pills continue to work their magic, keeping us healthy and safe from bacterial infections. So next time you're handed a prescription for antibiotics, remember the power and the responsibility that comes with these tiny pills. They're not just drugs. They're a testament to the wonders of modern medicine. And with that, we've unraveled the mystery of antibiotics. They're more than just pills, they're tiny soldiers, fighting off bacterial invaders and keeping us healthy. So here's to antibiotics, the unsung heroes of modern medicine. Voiceover. As we've seen, antibiotics are our unsung heroes, fighting off bacterial invaders and keeping us healthy. But what do these heroes look like? Let's take a look at some common antibiotics we use in our daily lives. First up, penicillin, one of the earliest discovered and widely used antibiotic agents. It's been a game changer in treating bacterial infections since its discovery. Next, we have amoxicillin, a go-to antibiotic in the treatment of a number of bacterial infections. It's a familiar name in many households. And then there's ciprofloxacin, a potent antibiotic used to treat a variety of bacterial infections. These are just a few examples of the many antibiotics that help us fight off infections, each one a hero in our battle against bacterial invaders.